What I will tell you, this topic is definitely something that is so important. So I'm just so happy to be able to share in some capacity or form to our community. So this is something that we're definitely going to delve deep into. And I just hope that everyone takes the opportunity to really, you know, take heed to some of the things that we're saying about healthcare disparities and really get, use the Q&A that we're going to have to be interactive. So that'll be exciting. All right, so we have quite a few people that have logged on. So we're going to go ahead and get started. All right, so hi, everyone, again. My name is Dr. Tamika Blake, and I am an emergency physician in Metro Atlanta. And I am here with my sisters in medicine, Dr. Kalia Johnson, with her expertise is in pediatrics, as well as Dr. Aderonke Oguntoye, who is specializing in psychiatry. So we have a wealth of information that we would love to share with you all. And welcome to Defeating Disparities, COVID-19, Myths and Misinformation. Where do we go from here? So I just want to give you a little intro of what we're doing. Why are we here? Why are we even deciding to have this conversation? Recently I looked up the definition of disparity, and I know a lot of you have heard about disparities through the news outlets of some form, and the meaning or definition was great difference. Okay, and that's so important to understand. What's a disparity? And what we have identified is that basically, when you have a great difference in healthcare, that changes sometimes the outcome. So that's what we're definitely wanted to take a look at and delve deep into. And with the COVID-19 epidemic, well, really pandemic that has affected so many lives, we have seen that in our Black and Brown communities, that we have been more and disproportionately affected. And that is something that we really want to speak to. And this pandemic has highlighted the healthcare disparities that exist. Now, let's be clear. The difference in healthcare for Black and Brown communities have always been there, and there's some institutionalized um, institutionalized things that lie in our country that make that happen. But what the pandemic is really did was put it at the forefront. So we want to bring our expertise in medicine and really give you some concrete information and knowledge and empower the community on how you can better help care for us. So as Black female physicians, we represent 2% of the physician population. And, for those of you who have reached out and have said, where is our voice? We are literally struggling for our lives out here. We are fighting the fight. And that fight is just not in healthcare. Right now, our country, we're in distress. So we understand that healthcare is just a piece of the puzzle, you know? So we want to create and just give you some information on how to better care and empower your own healthcare for yourself, for your families, for your children. So, what we'll do in terms of the format and the layout, each of us is going to speak individually about our different expertise and how it relates to COVID and really empowering with that knowledge and information. And then afterwards, feel free, as we're going along, you can go ahead and put in questions and comments, and then we'll have a very interactive live Q&A. Okay, so I actually, once again, I'm Dr. Tamika Blake. For those that are just joining, I am an emergency physician, and I want to talk about specifically how to advocate for yourself. So the emergency room is typically the first place that you go to, okay, when you have some type of problem or distress. And I need our people, our Black and Brown communities, to be able to know how to advocate for yourself. So I'm going to go over 5 different points on that is very helpful to you. So number one, So the first thing that I think that's very important to know, we need to be able to describe how we're feeling. Now, you may say, what does that mean? So, as a physician, I have to be able to identify what is your medical problem. So, I'm going through all these different things that could be going on with you, and I need to be able to identify what's going on. So, when you go to emergency room, now is not the time to be shy, prideful, and really uh, can't you hold back information about what you're feeling. And I'll give you a perfect example. So I'm from Brooklyn, I'm from New York by way of Jamaican parents. I love my Caribbean culture. But I could have a patient come in who has Caribbean descent. And when they come in complaining of chest pain, instead of saying chest pain or I have pressure, I have a tight. And they say, oh, I have a tight in my chest, or I have, it's very difficult to get it out of them. I'm like, well, what's that? And then when you're like, well, you're having chest pain, they're like, no, I'm not having chest pain. And I have to literally tell them that anything in the front of your chest is discomfort or pain. So just because you may have that pain there does not mean you're having a heart attack, but we need to be able to look at all the things that can be going on. Another example, they'll say, oh, I'm having indigestion. And when they point to their chest, but they think it's their stomach, and we're so, wanting to dismiss symptoms. So we have to be able to describe what we're feeling. Just tell us what's going on. So that's number one. Number two, you have to know your health information. That is so key. Now, let me describe what that means. So, when you go to the doctor, the emergency room, typically they'll ask a question. What medical problems do you have? And I have had this happen to me many a times. They'll say, ma'am or sir, what medical problems you have? And they don't know. You don't know what medical problems you have. And then I have to be kind of searching, trying to figure out what's going on. Or better yet, they'll say, oh, I don't have any medical problems. And then I'll look to the left and I'll see a bag full of medicines in the chair. And I'll say, well, who do those medicines belong to? Oh, they're mine. I take a pressure pill, a sugar pill, a cholesterol pill. And I'm like, you just told me you didn't have any medical problems. They're like, oh, but they're controlled. Even if you're controlled for your medical illness, you still have that medical issue. So we need to know, why does that matter with COVID-19? The data has shown that if you have pre-existing conditions, you are more at risk to succumb to disease, meaning you'll have more complications. And a lot of the patients that have died from it have had many of those pre-existing conditions. So when you're going to the emergency room in a time of pandemic or even at all, you need to know that. That is something paramount. And in the day of technology, you have these apps where you can actually, a health app, I know iPhones have a health app, you can put in your information. You don't have to know how to pronounce those medicines. Just type exactly what's on the bottle, put it in there. That's how we can better care for you as your ER physician. Number three, it's time to ask questions. Now, what do I mean by that? I'm pretty sure many of us, if we've ever had to seek emergency care, you're there for hours, and at the end of the visit, a doctor comes in the room and they look at you and you say, your tests are negative. And you're like, okay, doc, I'm ready to go home. No, stop. Absolutely stop. Do not allow us, the doctor, to say now it's good that you're negative. Like your next question is, what does that mean? What did my lab test results show? This is so key. It is the doctor's responsibility to explain to you what your test results shows, what your imaging, you're there for hours, they're doing blood work, they're doing x-rays, CAT scans, they're doing all of these things. And it's not okay for them to just say, go on. You know why? I bet you many of us have gone to the doctor or you've gone to the emergency room and we did not even know what our blood pressure was. It is okay to ask a question. Nurse, doctor, what was my blood pressure today? You know why that's important? Many of us are borderline hypertensive and have no idea. So what happens is you have a blood pressure, normal is 120 over 80 or less, right? You could have had a blood pressure of 130 over 90. That's that's high blood pressure or pre-hypertension. You need to know that, because what happens if you're walking around a month from now, 200 over 100, you have no idea. You've had a stroke. You could have a stroke. So you have to know. Blood tests. We do a lot of blood tests. Say, can you explain to me what we did today? So I know sometimes we just feel like we may be bothering a doctor. They're busy. Nope, that's their job. I'm here to tell you, we are one of them. We're supposed to teach you and tell you what we did to you. You got all those pokes and prods. They ran you through a CAT scan. They did all this stuff. Sometimes there are incidental findings, like you can get a CAT scan and say you went there to make sure you don't have appendicitis, but then they might have saw a nodule somewhere in the lung. You should know that. That's something that could become dangerous later on in life, and you should be checking on that. So it's time to ask questions. Number 4, what next? When you get discharged, you should know what to do next. Now, once you've asked questions, it is the doctor's job to give you follow-up and discharge information, okay? Now, what does that consist of? And particularly in the time of COVID, this is so key. The majority of people who were seen in the emergency room for COVID symptoms went home. So that means you had symptoms and you were discharged, and they said, you're not sick enough to be admitted to the hospital, so you're going to be discharged. But you should know what to do. You should know if you should come back if it worsens. They have to tell you. And most of the patients who were seen in the emergency room and got discharged, they were not tested. It's okay to say, are you going to test me today? And I will tell you, the answer is likely no. Now you're like, well, why aren't they testing me in the emergency room? And I got COVID and they said this thing is deadly. Well, that's where governing matters, because I will tell you that if you ain't got enough tests to test, what are you going to do? We can only do what we have the ability to do. And I had to explain that to a lot of patients, that so from the emergency room, if you were discharged, many of those patients were not tested. So then you say, well, how do I get tested? I'm like, well, now we have resources. You can go, depending on your city and state, you can go sometimes to the public health department to be tested. And shortness of breath, that is a sign of distress. If you are able to walk up 5 stairs or a flight of stairs without difficulty, and you have COVID, and now you can't get up 3 steps, that's a problem. That's not, oh, it's just COVID. This is getting worse. You need to know the symptoms so that if you need to come back and seek care. So those are so key. So you need to be able to know what to do next, okay? And number 5, the last point that I think that needs to be addressed, and this is where it really hits home. When we decided to do this forum to really speak to our community, we had no idea we were going to get to 100,000 deaths. These are 100,000 souls that have been lost. And I want to really make sure we understand that that's not normal. In months, this is not the flu. And delaying our care and waiting to the very end is a death sentence. And number 5 is we should not delay our care. And I know it's scary, because I know with a pandemic, there's no visitors. You're like, well, what are they going to do to me? I had no one there to help me, to advocate for me. But if you wait till your shortness of breath is so severe where you're like pulling off your clothes and you can't, that is disaster. What's going to happen is those are the people that end up on ventilators. And the data shows that if you end up on a ventilator, 1 out of 2, 50% will die. This is not a joke. So we cannot wait. We cannot dismiss our symptoms. We cannot say, indigestion is chest pain. My arm not working is just tingling. That could be a stroke. We have to get checked out. It is so important. Now, I will say that there's so many things that I can tell you about how to care for yourself better and when it comes to emergency care, but those 5 things are just the tip of the iceberg, and I wanted to really share that with you. So with that, I'm going to turn it over to Dr. Kalia Johnson, and she will tell you a little bit about herself and then really share with you her expertise in pediatrics and how it relates to COVID.
Good evening, everyone. Again, my name is Kalia Johnson. I am a pediatrician also living in Metro Atlanta. I'm a general pediatrician, but I have a specialty in pediatric palliative care. So that means I take care of children with all varieties of very serious illness across their disease spectrum. And I also have a particular focus in working with children and families who are affected by HIV/AIDS. So my work as a pediatrician has me thinking a lot about the impact of COVID on children with serious illness, but also children in general. I think oftentimes in conversations like this, children are lost or they're forgotten about. They really rely on us as adults to help give them voices. And that's children from newborn age all the way up to adolescents and young adults. They really are looking to us to stand up for them and make sure they have what they need. And by doing that, we build healthy children who then go on to lead our communities and lead our country. So I want us to be particularly thoughtful about how this pandemic is affecting our Black and Brown children, because already at baseline with disparities, there are unique challenges that they face that we need to be thoughtful of, and we want to make sure they're getting what they need through this. So the first thing I'd like to speak to along the vein of 5 points, I'm going to really try to focus on 5 areas so that you can take away those salient points or those key points, is first, how do we think about COVID-19 in children and transmission in children? We've heard a lot throughout this pandemic about how many lives are being lost, who's really sick in the hospital. The reality is that most of those people, the vast majority of those people, are not children. Thankfully, we are seeing the burden of the illness, the disease, to be much less significant in children. But there's still some real realities to be aware of, in that children can still get sick with COVID-19. Their symptoms tend to be much milder if they actually get an infection of COVID-19. And they are often what we call asymptomatic carriers. So meaning they could actually have the virus living in their airways, their respiratory tract, and present with absolutely no symptoms. The reason why that is important is because then those children can become what we call a vector, meaning they are a means of transmitting that virus potentially to people who are at higher risk for getting very ill. So the elderly, people within the household who have some of the chronic conditions that Dr. Tamika spoke of, hypertension, diabetes. My mom is in her early 40s, she has high blood pressure. If the child's an asymptomatic carrier and exposes mom could end up very sick. So because of this reality, we want to make sure that the same precautions we should be taking for ourselves and the community to protect ourselves against COVID-19, we need to be doing for our children. So the basics of that, I think most folks are familiar with now, but just to review, we want to be masking if we are out in public. For any child who is 2 years of age or older, the American Academy of Pediatrics and the CDC is recommending that child should have on a mask. In turn, we want to be really diligent about hand hygiene, hand washing. So anytime we're touching things out in public, even within our household, making sure several times a day we're washing hands with soap and water for at least 20 seconds, or if we're using a hand sanitizer, we're covering all surfaces and making sure we're being thorough. Also reminding children about the importance of trying to avoid touching their face, which is really hard for little ones, but it's a good thing to remember because that helps to cut down on the asymptomatic transmission as well, or just transmission in general. I think it's really important to note when talking about the masking that there's this undercurrent concern in our communities in particular. What does it mean for our young Black boys and young Black men to be wearing masks out in public? How does that make us uniquely vulnerable in a society where people are already suspicious of us and frankly threatening our lives for no apparent reason? That fear and concern is real. It cuts to the core of each of us. But what we don't want to happen is that fear and concern stops us from masking, because the reality is we are seeing men in their 20s, 30s, 40s dying from COVID-19 right now. So what we encourage is use your best judgment. Make sure the young boys, young men, everyone in your household has access to a mask to the best of your ability. Masks that are not as threatening, lighter colored masks for the kids, masks with cartoon images. All of those things are good things, and we should be encouraging them. We are a creative people. Whoever sews in the household, get people making masks, handing them out to people in the family. Churches are making masks available. Do what you can to make sure you're resourced. And if you are having trouble getting access, I always feel your first line help should be your pediatrician's office, or again, your doctor's office. That is our responsibility, is to help figure out how to keep you safe. So don't hesitate to pick up the phone and ask us if you need that help. Point number 2, how much should I worry about my child getting sick from COVID-19? Again, we know children infected with COVID-19 tend to be much less sick on the spectrum than adults, but we want you to be mindful. Really pay attention to any symptoms of illness in your child. And to Dr. Tamika's point, don't delay seeking care. Most pediatric offices now have some semblance of office hours, be it in person or virtual telehealth visits. So call us and we will get you sorted. If your child is demonstrating any symptoms that are of significant concern, any shortness of breath, if there's a fever greater than 101, if there is any weird, odd rash or persistent vomiting, those are all things that I would put more on the spectrum of more urgent or emergent symptoms. And in that setting, even with weighing the risk of COVID-19 exposure, it's probably best to present to an urgent care or to an emergency room to make sure your child gets the attention that they need. At this point in time, we're still seeing the general illnesses that cause sickness in children this time of the year, aside from COVID-19. We're getting into the time of the year where we see summer viruses. Some of these viruses can make kids really sick with symptoms of headache, neck pain, meningitis-like symptoms. Enterovirus is the one I'm thinking of in particular. Pay attention to your children, take their complaint seriously, and don't delay. Which also leads me to want to prompt everyone to remember the importance of keeping up with well child visits. We know, looking at the statistic now, that well child visits and immunization rates are down by about 25% nationally because people have fear about presenting to the hospital. But again, that risk of children getting illnesses from not receiving their vaccine series on time is not insignificant, and in turn it can delay admission to school. So when school's opening up in the fall, you want to have everything in order, and pediatricians' offices are standing ready to make sure every child gets what they need. My clinic has, throughout this pandemic, been running hours to get kids in to make sure they're keeping up with their shots and their Welch Health visits. So very important. Point number 3, managing grief in children. I think it's really important to acknowledge that all of us right now are experiencing a global grief. This experience is nothing like we've ever experienced before. It's not normal, and it's involved a lot of loss, on top of the realities of what's going on in our community right now with police brutality and all of the things that are causing profound sadness for all of us. And with that being said, children experience grief response too. That's very real. Our children's realities have been ripped away from them. They are used to being with friends, being at school, engaging with the people they love. My son, at the beginning of the epidemic, he was having so many tantrums, and my dad and I would say to him, "What's going on with you?" I was like, what's wrong with you? Why are you giving everyone such a hard time? And at one point, even with his 4-year-old little self, he looked at us and he said, "I can't understand this. I can't see my friends. I can't see my aunties, and I can't hug. This is hurting our children, and they deserve the space to grieve and express their emotions and not have us silence them." I think there's this tendency in our culture and many of our communities to hush, talking about our Caribbean background, Tamika, like, hush child, hush, you don't, like, stop talking. But why? They need to get this out. They need to be able to express it. And for children who are younger, they may not have the words. So it comes out with symptoms of hyperactivity, with symptoms of inattention, with symptoms of tantrums, behavioral outbursts. Our teenagers might be withdrawing. Whatever we could do to tap into outlets for them, giving them voice to things that help them in this process, we want to do that. And using our words too. A phrase that I think is very helpful is saying, "I know this is hard, and a lot has gone on, and it's gone on longer than we've expected, but I am here for you. We are going to get through this, and we will get through it together." And that is how we do. We are a communal people. We pick up for our children, we pick up for each other, and sometimes we just need to say that. Our kids need to hear us say that, even the little ones. Point number 4, what's happening behind closed doors? The stress of COVID-19, and what does that look like? Just important to acknowledge, with children being at home, parents working from home, trying to homeschool while working, everything's upside down. No one has their routine. We're trying to figure out how to pay the bills, how to make all the ends meet. This is an unprecedented degree of stress that every family is experiencing. And to that, as parents, as adults, we need to monitor our stress levels, because our stress has the ability to directly impact our children. We know children are thermometers for our emotions. They are going to pick up on what's going on with us. So whatever you need to do for yourself, which Dr. Ronke is going to talk more about, you need to do that. Be aware of your emotions. Put yourself in timeout. I've had to do that several times these last few weeks. Remove yourself so that you're dealing with stress, because what we don't want is more abuse, more intimate partner violence, more child abuse. We've seen on the pediatric side that we're getting less reports than usual of child abuse, but we know that does not mean it's not happening. It is happening. In fact, if you look at some of the call rates coming in on the national hotlines for child abuse, Some of those call lines are reporting a 25% increase in reports of child abuse, with children calling themselves saying, my mom hit me, this is going on, but they're not presenting to the ED, they're not presenting to the pediatric office because of COVID. So we need to pay attention. If you hear things going on with your neighbors, with other people in your family, do not hesitate to report it, because as Dr. Tamika said, this is our life. These are life and death matters. And the final point I'll make is about food insecurity. In pediatrics, we think a lot about the importance of nutrition and the health and well-being of children and their growth and development. And right now, a lot of children do not have good access to food because school is closed, and many children rely on school breakfast and lunch programs to get food. So just be thoughtful about that. Look out for people in your community. If you know there's a family a few doors down that has a number of children and they're working hard to make ends meet, offer to make a meal, find out about food pantries, help with getting people access. And if that's the situation you're facing, you're not alone. It's common right now. Please call us as pediatricians because we want to plug you into resources. And with that, I'll turn it over to Dr. Ronke.
Good evening, everybody. I'm Dr. Ade Ronke Oguntoye. I'm an adult and forensic psychiatrist based in New York City. I work both in a hospital setting as well as in an outpatient clinic setting. And I just want to remind you guys to continue to submit your questions for the Q&A session that's going to follow my bit of the talk in the chat. So the reason that the three of us came together is that it was important for us to realize that your health is not seen in discrete parts. You're not one person who goes to the emergency room, a different person who takes his or her child to the pediatrician, and a third person who goes to see their therapist. All of these parts interact with each other. And if we're not taking care of one part of ourselves, another part is going to suffer. This coronavirus situation is one that is overwhelming. It's overwhelming for every one of us. It's scary. There's so much unknown. How bad is it going to be? When is it going to be over? What are things going to be like once it is over? Literally, nobody knows how this is going to turn out. It's completely uncharted territory. And at best, even the smartest and most informed among us are operating off of educated guesses and adjusting as new information becomes available. I think the thing, at least for me and what I'm seeing with my patients, what has been the most distressing about this pandemic is how much we've lost all of our sense of structure and routine. We are people who often define ourselves by what we do, what we drive, what we wear. And really all we're doing now is driving from our bedroom to our living room, putting on sweatpants and sitting in front of the computer doing Zoom meetings. We don't commute to work anymore. We don't have that time alone in the car to sing loud and off key. We don't have those impromptu happy hours after work, those dinners to go to unwind before you come home. We don't have all of our normal social outlets for fun and stress relief. And on top of that, we've gained a lot of stress, be it by loss of income, by job insecurity, by the fact that your kids don't have daycare anymore, your older kids aren't going to school anymore. Now you are trying to work full time, be a homeschool parent, a short order cook, and a maid. We have to recognize that all of these changes and stressors can be activating for old traumas around scarcity, being alone, or being confined. In addition to the trauma of witnessing over 100,000 people dying in a matter of 3 months, in addition to that massive loss of life, we're constantly assaulted with story after story of violence against innocent Black people by white people and law enforcement. Existing as a Black person in America, it's impossible to be a stranger to trauma, be there macroaggressions as with George Floyd or with Breonna Taylor, or microaggressions like being called intimidating because of nothing other than who being yourself as a person, or being told that wearing your hair the way that it grows out of your scalp is unprofessional. The world casually watches Black bodies being beaten, broken, and killed over dinner in the nightly news. We're treated as second-class citizens in the eyes of the law and in the eyes of the healthcare system. This exposure to these repetitive traumas can lead to depression, anxiety, stress reactions, substance abuse, suicide, and other forms of misplaced aggression. It's no wonder that domestic violence is at an all-time high, and worse still, that financial strains can limit the ability to separate ourselves from these undesirable situations. As I stated in the beginning, it's overwhelming. What can we do? The first thing I would like to recommend that we do is that we all learn to feel our feelings. That means give yourself permission to feel what you are feeling. Some days you'll get up, you'll run 3 miles, you'll make a meal from scratch, and you will feel like you are doing it. Then the next day you might not feel like you can get out of bed and you're just gonna eat cereal for dinner. And you know what? That's okay. Give yourself a break. You will not do everything perfectly. Nobody is doing it perfectly. I don't care what their social media says. Don't be afraid to set physical and emotional limits, be it with work, home, friends, or family. We can't expect our productivity at work or at home to be the same as it was before this. You should not be afraid to also take vacation. We feel like, oh, we're working from home, or I don't want to waste my vacation days or whatever if I'm not going anywhere. You do need to take vacation. Sometimes you need to take vacation just to do nothing at home. Sometimes you need to tell home to take care of itself for a little while you go off by yourself and have a little moment of peace. Be in tune with your body. If it's telling you today is not the day, then you need to listen. Don't push yourself past your breaking point. But if you're finding yourself living at your breaking point, then that has to also be a red flag for you. You need to ask for help when you need it. You can't just wallow in feeling bad. One bad day is not a big deal, but if it's dragging on and it's becoming days and days and weeks, and you're sinking too far into something that isn't healthy, whether it's sleeping too much, eating too much, drinking too much, smoking too much, yelling at people, you need to start pulling yourself out of it. And that might be something soft, like turning off the news cycle. Don't watch that awful video of somebody being beaten if you can't take it. You know that it happened. You don't necessarily need to see the image. If it makes you feel bad that people's lives are looking too perfect and together on Facebook or Instagram, stop looking at it. Get out, get some fresh air. If you can't pull out of it on your own, you need to ask for help. There is no shame in asking for help. We are all struggling. Stigma against seeking mental health treatment in our community is real. It causes us to suffer needlessly and in silence. This is one of the reasons I went into psychiatry. Sometimes finding a provider who looks like you can help you feel comfortable enough to start the conversation. There's many options for help, whether it's telemedicine, we have support groups, crisis lines, online therapy services, but not one of them can be helpful to you if you don't make the first step of making that initial contact. Don't be a martyr. There's no reward for suffering just for the sake of suffering. Take that vacation. Learn to say no and don't apologize for it. Ask for help. Finally, most importantly for us, we have to find a way to maintain a sense of community through all of this. Divide and conquer has long been a tactic to weaken a group that is too strong to be broken as a unit. We are strong, and together we are stronger. We will not be broken. Social distancing doesn't mean that we have to be socially distant. Reach out in creative ways. Social distancing get-togethers. Call instead of text. Don't let someone get away with just saying, oh, I'm fine, when you know they're not fine. You know your friend, that if they don't sound fine, press them. We must keep and improve our sense of community. We cannot come out of this scared of each other. We're the most affected. And if we don't come together and take care of each other, clearly nobody else is going to step up and do it for us. This is only the beginning. The first wave is not over, and in all likelihood, a second wave is coming. The fight is not over. We need to position ourselves in as best a position as possible to advocate for ourselves and those who are not able to advocate for themselves. There's a saying that if you want to go quickly, you go alone, but if you want to go far, you go together. You tuned in today because you wanted to know where we're going from here. So clearly you're in it for the long haul. That means we have to do it together. And with that, I would like to open up the floor to go through the questions that you guys have been submitting in the chat. Thank you.
So before we move on to questions, I have to commend both of you for just an awesome job of lending your expertise. And before we decided to do this forum, I told both of you how much wealth of information that you all had and us as a collective, and it was time for us to share it with our community. So thank you for that, my sisters. So we do have some exciting questions, so we're just gonna, forgive me, trying to get everything in. But one question and theme I saw was, it says, thank you. Well, she said, this is from Pam. She said, thank you for doing this. The most frightening thing for me as I consider the prospect of navigating a potential hospitalization is having myself or a loved one hospitalized alone. How can you advocate for your loved one when you can't be there? Absolutely. I found that so heartbreaking, particularly for the patients who we know were in distress on the brink. And I would particularly say, make sure that we have a contact for someone, you know, make sure that when your family member goes in, and if you're the point of contact, let them know that please call my friend, call my mom, call my husband, whoever, update them. The patient who's going in to be seen can let the team know to call them. So normally you shouldn't give information over the phone, but during COVID, we were not allowing visitors.
Yeah.
So we have family members who are left in the dark. And then if that person is not able to speak for themselves, like if you have an elderly person who has dementia, who's not able to speak for themselves, you call the emergency room. My family member is such and such. They were brought in for such and such. Can I please speak to the nurse or the doctor who's caring for them? You have that right. So I think it's so important to know. I think a lot of time we don't realize that we have that ability. And if you don't get that information, advocacy. Do you know that a lot of hospitals have a patient advocate? Say, well, okay, if you're not getting anywhere, can I please speak to the patient advocate? All of a sudden, like, oh, okay. Or the supervisor. Then can I please speak to the nurse, the house or nursing supervisor? I guarantee you someone should be getting back to you. So getting to know that you will have the right to know information is key. And I'll see if anyone else has, Dr. Oguntoya or Dr. Johnson has anything to add for that question.
Go ahead, Kalia.
I would also add, those are all great points, Dr. Tamika, that this is a time where technology is really our friend. As I mentioned, I'm a palliative care doctor, and I've been talking a lot with my palliative care colleagues on the adult side who have dealt with some very real and difficult situations through this, of how do you help patients who are really critically ill, where there might be life or death decisions, to have the support of their family when we have limits on the number of people who could be in the hospital. And sometimes if it's a COVID-19 positive patient, no visitors at all. And really iPads, phones, WhatsApp, whatever you use to video chat, is really important and really helpful in this scenario. And like Dr. Tamika said, don't hesitate. It's not wrong to do that. There's nothing wrong even with turning on the video ability, the FaceTime, and just keeping it on as long as you have enough minutes to do that, enough cell charge. If you're concerned what's happening in that room when I'm not there and I can't see, that gives you a direct way to see what's happening in that hospital room and for your family to be able to engage.
The only one point that I want to add is that when you are wanting to be the point of contact between the medical team and the patient, there needs to be one. Speaking as a doctor who works in the hospital, it is very challenging when you're very busy, have a lot of patients, and each different family member wants to speak directly to the doctor to get the story directly from the doctor. We can't do that. You have to pick one family member to be the point of contact who then distributes the information to the rest of the family. If you want to have one backup person, you can, but it is really important for there to be one person who is the one who talks to the medical team and distributes the rest of the information to the rest of the family.
Oh gosh, that's so important. Thank you, Dr. Elgintoya, because I forgot, to having to repeat the information over to multiple people and having that one healthcare proxy is so key. The next question, is it realistic to produce an effective vaccine for COVID-19 by December 2020? I will let any of you take that and I'll speak last on that.
No.
Oh boy.
We would all love it, but you guys have to realize that producing a vaccine takes time. There's developing the vaccine, there's making sure that the vaccine actually vaccinates against what you want it to, there's making sure that it doesn't make some other new problem before you unleash it on the population. I'm not God, and I mean, I could be wrong, but I would not hold my breath for a vaccine being ready by December.
And only thing I will add is the data. Typically, vaccines take 12 to 18 months. That's all I'll say. 12 to 18 months. COVID-19 was named COVID-19 because the first infected person was identified in Wuhan, China in December of 2019. So technically, we didn't get started till several months later. So, and when I say 12 to 18, that's really shortening it. That's the least amount of time. We have 375 million people in this country. If they're going to vaccinate that many people, we better get it right. So, you have anything else to add?
Yes, I will offer, as we're thinking about vaccines, be leery of conspiracy theory. I think in our community, rightfully, with the healthcare system, there is a healthy degree of suspicion. What are these people making? What are they trying to test on me? Can I trust it? And at baseline in our society, not just our communities of color, Black and brown communities, across the board in the US, I think that I will put myself out there and say, an unhealthy degree of suspicion about vaccines. The pediatrician has to speak up and say, vaccines save lives. This is why I'm saying we need to remember the standard vaccines. Children need to get in to get immunized. When we've had enough time for a COVID vaccine to go through the appropriate trials, and what's going to happen is it's going to happen in phases. Not everyone's going to get the vaccine at first. There's going to be some plan to roll it out to higher risk individuals first, trial it. There's all these trials happening now. There's a lot of my colleagues in the labs right upstairs from where I'm working who are working 20-hour days, 24-hour days to try to get this right. When it goes through that time frame, then it will be a period where we at some point have to take a leap to trust that this is safe enough, because in order for us to maintain stability in the society of people not getting sick and dying, we're going to have a combination of herd immunity and vaccination. It's going to be those two things together. So all of this is to say, yes, December we won't be ready, but when it is ready, we need people to trust, and we also need you to be getting the regular vaccines that are out there for children and the elderly who need it. Pneumococcal vaccines for the elderly. Like, be thoughtful about that.
So the next question, ladies, any updates on immunity for those who've recovered from COVID? So I did recently do on my YouTube channel, Dr. Tamika Blake, a little COVID antibody testing regarding that. And what we spoke about was, what does it mean when you test positive for the antibody? It just means that you have likely had an infection and did not know, or you've been exposed to someone who did. That's it. Now, the infectious disease doctors have been very careful not to say that this means immunity. Now, the thought process is hopefully that you should have antibodies to fight it, so you're not likely to succumb to it if you were to get potentially reinfected. But no one has said that this means immunity. So I know that now those tests are being heavily offered. I myself tested just because I'm an ER doctor, and I was seeing so many potential cases in the beginning. And although I had no symptoms, I wondered if I was positive or negative, and I am negative for the antibodies. So all that means is that the protective personal equipment works, PPE. So that's a good thing that I don't have antibodies. But there is no clear data that suggests that you'll have immunity. Let's see. What's the best way to find the right fit for a mental health professional? I think I'll let Dr. Oguntoya answer that one.
That is a very personal fit. And it also, when people say mental health provider, they have to understand that there's a lot of different options. People have various degrees. People say like my therapist or whatever, and that really doesn't tell you anything. That could be anybody from a mental health counselor to a social worker to a psychologist with a PhD to a psychiatrist with an MD, to people say that about life coaches. People say that about a lot of people. They call them their therapists. So you first have to decide what it is you are looking for. Are you looking to just do talk therapy? Are you wanting to be in a group? If you're looking for individual counseling, do you think that there might be a possibility that you might want to try medication or not? All of those would influence your decision, because of all the people I named, the only one who can prescribe you medicine is an MD. In some states, they allow PhD psychologists to prescribe under an MD's license, and the same with a nurse practitioner, but they are all have to be supervised by an MD if they're going to be prescribing you medicine. So if you're looking, so what I would say as far as finding a good fit, everyone, I get a lot of calls about people wanting to have a Black psychiatrist. And as I mentioned in my talk, I understand how seeing someone who looks like you might make you feel more comfortable, but you should not necessarily X someone out just because they are not Black too. Because we're all three Black women, but all of our life experiences are different. Even though we've known each other for all these years and we've gone through a lot of things together, still all of us are very different people with different personalities, and you're going to connect with each of us differently. So what I would say is sometimes you're going to have to just test it out. Sometimes you're going to have to go to that first meeting, and sometimes you're going to love that person and you're going to find that person easy to talk to, and sometimes you're not. So it's a little bit of trial and error. And I guess the other thing you have to decide is if you're wanting to be tied to your health insurance or not. A lot of people want to try to find somebody in their network so that they, because it can be costly to pay out of pocket. A lot of people feel frustrated because they can't find a person of color who is accepted within their network. A lot of us don't take insurance. It's a whole conversation about why we don't. But it's something to consider if you really want to work with someone and they are not on your insurance panel. You can look at whether your insurance covers out of network benefits, because they actually might reimburse you for, a percentage of what you're paying out of pocket. You can also put money into your flexible spending in order to at least pay that money pre-tax. You can also talk with the provider who you are interested in talking to find out if they might offer a sliding scale or have any other resources to help you if they aren't on your panel.
There was a follow-up question regarding the COVID test versus antibody test. So that's a great question. So those are two different tests. So if you have symptoms of COVID, and that is your classic flu-like symptoms, fever, chills, cough, shortness of breath, sometimes sore throat, body aches, nausea, vomiting, diarrhea, dizziness, headache, fatigue. It goes on, right? That is a person that should have the nasal swab that they put in the back of your nose, and it should hurt. That increases the chance of getting an accurate test, like it's way back there. That is a COVID test. Those are the patients who should get that. Antibody tests are for the person who, it's for the past 2 months we've had a pandemic, and I think I had allergies, but because COVID's been going on, I go get tested and it turns out those allergies was actually COVID. Okay. Or that sore throat was COVID, or I just felt really tired, but I feel better now. So that is so key, because if you're entering in society, you could potentially still be in the window of quarantine. So you could potentially infect someone else. So that is why that's so important. But I do have a question in regards to children for you, Dr. Kalia. How
Yes,
much,
and before the
go ahead.
question, can I just tag something onto what you just said as a point of clarification? So it's really excellent to clarify this antibody test and what it means. And so when I talked about ultimately what the experts, the infectious disease experts are saying globally, what it's going to take for us to push beyond the pandemic, is this combination of herd immunity and vaccination, with this idea that at some point there needs to be a certain percentage of people with immunity from having been exposed or been ill themselves, plus enough people getting vaccinated. The figures I heard at one point is about 50-50. If you could catch 50% herd immunity, 50% vaccination, then we'll be in a good place. The real only takeaway point from that is at some point we're going to need people to be receptive to the vaccine when it's safe, when it comes out and it's safe. Okay.
Okay, perfect. How much should I push my 7-year-old to always complete her school assignments versus just letting her be a kid and adjust and deal with what she's feeling? Kids get so much work these days, and it's hard to find balance between work and play. I have a 9 and 10-year-old, so I will tell you I've been struggling. So I'll let Dr. Kate talk about that.
Yes, it's a great question. I'm glad that you put it forth. I think it gets back to what I was saying at the beginning when we were all signing on: grace, right? Our kids need grace now too. And especially for those kids who are school age, even middle school kids. The high school kids we want to be a little bit more sticklers about because we're in college prep. We have deadlines, we have things we need to be accountable to. At the end of the day, for the kids who are a bit younger, really for all children, they need some space right now. They need some bandwidth. So I think, sure, schools have been doing remote education. We have remote curriculum, but most folks who are, their children are homeschooling now are saying we're lucky if we get through an hour to 3 hours of the 5 hours that's been laid out for us. And that's okay. Children are resilient. They will have mechanisms to catch up. But the caveat to that is that we know our Black and brown children are already at higher risk for falling through the cracks, not getting the support that they need, falling behind. So I spoke with a friend at church this past week who is an educator who was saying she's overwhelmed by the catch-up plans that they are already having to make and anticipate heading into the fall, because everyone's going to be behind. Just like Dr. Ronke was saying, we're all stressed right now. All kids are going to be behind. Our kids need us as the adults to again be having that communal mindset. How do we chip in? How do we put in the extra time to make sure they're getting what they need once fall starts up? It might mean we're having to put some extra resources in place that we never did before, but we've got to do it. And do not hesitate to ask your educators, again, your pediatricians, your family members for help with putting those plans together.
All right. Since COVID-19 is affecting minorities at a higher rate, do you think states should offer more financial aid and mental health support for an extended period of time?
Repeat the last part of the question, please.
Do you think states should offer more financial aid and mental health support for an extended period of time as
Well,
states begin to reopen?
I think states should offer more mental health funding in general. If we're being
Absolutely.
honest, I think that it is unfortunate that that was one of the things that they tried to attach to the Affordable Care Act, was what they call parity, where on health insurance, mental health care is covered at the same rate as physical health care. The way I started my talk was that it's so arbitrary to make that distinction between this is my mental health and this is my physical health. If you're too depressed to get out of the bed, how are you going to be taking care of your diabetes and hypertension? If you are, if you're there's a lot of psychiatric there's a lot of medical illnesses that present with psychiatric illnesses. There's times where someone looks depressed, their hair is falling out, they can't concentrate, they can't focus. They come to the psychiatrist, we check their blood work, we find out that their thyroid isn't functioning properly. It's very arbitrary. We are one vessel. So do I think they should extend the funding now and forevermore? Yes.
Yes, yes, and yes. I think we all agree. What can we do to prepare for the next wave? Okay, I'll start. So what we're already doing. Social distancing is not going away right now. And I know we want to get out there and live our lives in the best way, but we have to come to grips that this is not something that's going to go away tomorrow. We don't have a vaccine. I get it. The cases we've got the peak and we're going down. It's not gone.
And to that point, I will put our state on blast that
okay, Dr. K.
With the reopening early, we have been hearing reports in our state this week of a spike in cases. There is about a 2-week delay, but we know that cases are up. And I mean, what else? This is logic. What else is it related to? And if you go out in the street now in Atlanta, you see people no masks on the corner, living all kinds of ways. Like, it's just, we're not in a pandemic, and we just can't have that mindset now.
And
Go
I
ahead.
think that the other thing is we know that you have a worse outcome with coronavirus if you have pre-existing conditions, right? So what can we do to prepare for the second wave is get yourself as healthy as possible. Make sure you're taking care of your mental health so that you're on top of things. Make sure you're taking care of your physical health. Yes, the gyms are closed, but there's a whole thing, it's called outside. You can move around out there. You don't have to only go to the gym to work out. We should be trying to eat healthier. We should be, taking taking care of the things that we can. To Dr. Kalia's point, getting your vaccines, doing your well child visits, checking in with your doctor, making sure you're on top of what you need to be on top of. We're going to need to be as healthy as possible. You don't want the second wave to come when you're still trying to get up from the first wave. So the thing that you can do is get yourself into fighting shape. You should find out what resources are available to you. You should go to when things are down. Maybe that is the time for you to go to your doctor. I haven't had a checkup in a long time. Is there anything that I need to be aware of? What are some things specific to me that I might? We're giving you general things. There might be some things that are specific to you that you might need to address. Go to your doctor. Get your other vaccines. Eat healthy. Exercise. I think those are the and pay attention to social distancing guidelines, and don't think that just because things are opening that it's over and you should just go back to normal. You still need to be cautious.
And there was a question regarding how do we boost our immune systems? And I think I always get that question like, what can we do to make our immune system stronger? You said everything. What we should have been doing all along. There's not a herb or remedy that's going to be better than eating right, exercising, taking care of yourself, right? Because what we're doing is we're trying to do what those natural things will do for our body. Like we're trying to boost it, and we just need to exercise 30 minutes a day.
And listen
So
to your body. Listen to your body. When you start feeling sluggish, when you start feeling run down, when you're feeling bloated, you know that means you're not doing right. Everybody wants a quick fix and a magic pill and a special herb shot that's going to finish it. But like, listen to your body. If it doesn't feel right, you know when you need to start making some changes. You can't ignore it.
I would also add, circling back to one of the points Dr. Tamika made in the beginning, her last point of not delaying and the point prior of speaking up. I feel like the second wave for our communities does not have to mean what the first wave meant. That if we are looking at this and this disparity as a true opportunity to pivot and change things for our people, we're going to have to start doing things differently. So speak up, ask the questions when you present for healthcare. Don't let someone dismiss you. And I think the more we start doing that as a people, healthcare professionals, we all have implicit bias. We all have things in the back of our minds that we may not even be conscious of. The more we start standing up for ourselves, the more the tide's going to change. And it's not to say all the responsibility is on us, but if they start expecting us to act differently, they are going to start responding differently. We as physicians are going to start responding differently.
It doesn't only have to be Karen who asks to speak to the manager. Okay, we can all ask for a second opinion. If you feel like your doctor is blowing you off and you don't like their bedside manner, you're not chained to that doctor. Just because your insurance card says this is who your primary care doctor is, doesn't mean that you can't change them. If you're not happy with your care, speak up for yourself. Everyone has, whether it's patient advocacy, whoever you need to complain to, move your feet. Like they say, vote with your dollars. It's the same thing. If you're not happy with the care you're receiving, don't be afraid to go seek a second opinion.
absolutely. My daughter is 16 months old. She rips any mask off her face. Should I be concerned when I take her outside to walk around the neighborhood? We stay 6 feet away from anyone.
That's such a good question. Can you repeat again, 16 months?
Yeah, 16 months.
Okay. So what I would say is this, in what has recently been published from the American Academy of Pediatrics and the CDC, the recommendation is for 2 and older for us to be a bit strict about the masking. It's really hard to mask children who are younger than that, for a number of reasons. One, finding the right size mask. 2, if you notice little ones, the bridge of their nose is very flat, so it doesn't hold a mask well. So it's just practically, plus also too, they're often a combination of mouth and nose breathers, so it's just very challenging for their breathing as well when they're less than 2. So what we're saying generally is for children that small, of course, you always want to be thoughtful of how you're bringing them out in public, but fresh air outdoors is always okay. And you don't necessarily need to worry about masking in that kind of scenario, particularly if you're properly socially distancing. You as the parent, you're in the same household as that child, so it's okay. You're going to be close to the child, but someone else from outside of your household, even a family member who has not been in the house with that child, they need to be six feet apart from the child. If you're doing that, it's very okay. And as my sister doctors have been saying, the outdoor time is very healthy right now. The vitamin D, we need it. The sunshine, we need it. Like for our spirits, we need it. We're some people, get into the sun. It's healthy. And our little ones need it as well. So hopefully that helps.
So this concludes our very awesome interactive Q&A. And before we end this live, I really want to allow my sisters in medicine and thank them for coming together to create this forum, Dr. Oguntoye and Dr. Johnson, and I'm going to allow them to say any parting words.
I would just say in conclusion, this has been such an immense honor when Dr. Tamika, my sister, my friend, my everything, asked us to participate in this. I was so excited to do so, and I'm hopeful we'll be able to continue to convene forums to educate as a result of this. But we all have a responsibility in this. My father raised me to know to much has been given, to whom much has been given, much is required. And so this is just part of what we do, is care for each other, care for our people. And my hope in thinking about young people for this is that, again, COVID is not going to be the death of us. We know as a people, we have survived the utmost of utmost atrocities, and we will continue to rise. Let us use this as an opportunity to grow, to do better, to be better and stronger. And for our kids, I want us to be growing more resilient children who know how to handle stress better, who see their parents handling stress and life-threatening realities better than they did before this crisis.
I've always hated speaking after Dr. Kalia. She always, she's always so impressive, and it's just one of the many reasons that I admire her. I thank Dr. Tamika and I thank Dr. Kalia for us being able to come together and do this. I love that we were able to do this together. I thank you all for watching and participating. If there's any one thing that I would say to take, if you have to just pick one thing to take from this, I would say that it is listen to your body and know yourself. If you don't feel right, you need to ask for help. And that's whether you don't feel right emotionally, whether you don't feel right physically. If something feels off, we're spiritual people. If something doesn't sit right with you, you need to figure out what it is. whether it's that you need to go to the doctor. If you go and the doctor's like, everything checks out fine, and they say you can go home. But if you go home and you still don't feel right, then you need to go check on that again. And it's the same if you are not, as far as with your mental health, if you're like, I really just can't get out of this funk, or I'm not sleeping, I'm sleeping too much, I'm not eating, I'm eating too much. If something just doesn't feel right, you need to attend to it. Don't just ignore it. I think we do that a lot because whether we're scared of the doctor, we're scared of what it could be, but ignoring it doesn't make it go away. Be proactive. That going back to that question about getting yourself ready for the second wave, be proactive. Get in tune with your body. Know when something's not right and act on it early. The people say that, like, there's always that anecdote of my auntie was fine and never went to the doctor for 50 years, and then as soon as she went to the doctor, they told her she had all this stuff and she died. That means your auntie was not fine for 50 years. She was ignoring what was going on, and had she maybe gone to the doctor before, they would have found it when it was small and been able to do something about it, so she would have been able to go on and live another 50 years. There's a lot of misconceptions. Nobody goes to medical school. We go to school, nobody realizes you go to college for 4 years, medical school for 4 years, residency for anywhere from 3 to 8 years. Nobody's doing all that just to come try to get over on you. We go into this field because we love it. We don't make enough money to do it just for money. We don't make money off of the medicines that we prescribe to you. We don't make money off of the procedures that are done to you in the hospital. We're doing them because we genuinely think that it's the right thing to do for you. So please check in with us. If something doesn't feel right, give us a chance to help you, and realize that we are all trying to be on the same team.
And I will just echo a lot of the same sentiments. It is a pleasure. It is an honor. You both have exceeded my expectations of what we did today. I'm thankful that we were able to share your wealth of knowledge with our community. And I believe that everyone has joined will be very thankful as well. My parting words are this: allow yourself to feel, whether it's your mind, whether it's your physical body, or whether it's your soul. Now is the time that we should all be feeling what is inside of us, getting closer to something, grounding ourselves, foundation. For me, it's my family and my faith. So I am offering that piece of wisdom to you all. And I hope that you really take some of the things that we've shared with you to heart and are able to use that in your help, in your care, and we can help to defeat the disparities, because we don't want a difference. Everyone should get the best care. And lastly, I'll just say where you can find us. I am on Instagram at Dr. Tamika Blake, also on Facebook and YouTube. So if you want to get in contact with me, that would be would be the best way. And Dr. Ranke, would you share how they can get in contact with you? A Black female psychiatrist in New York City.
Yes. So my Facebook page is Dr. Aderonke Oguntoye. My Instagram is at Evolve with Dr. O, DR, not spelled out doctor. And my webpage is www.evolvepsychiatricservices.com. So if you go to any of those, you can find me. Thank you.
And Dr. Kalia Johnson, we haven't even gotten into the work she does on a global health perspective. And I'll let you share just briefly how they can get in contact with you on Instagram.
Sure. So I do have Facebook, though admittedly I don't get on it a lot. My Facebook is Kalia A. Johnson, MD. And I'm also fairly active on Twitter. You can find me at Dr. Kalia, Khaliah. And then, sorry, the light in my office just went out. My Instagram handle is at WERARE Wendo, WENDO. And that is the name of my nonprofit initiative that empowers women in rural Kenya in their health. And so you could check that out at our website, wearewendo.com. And I'm also happy for people to email me. I'm an academic pediatrician, so I'll put it out there. Anyone could Google me and find me on Emory or CHOA's website. My email address is Khaliah, KHALIAH .Johnson, JOHN, S as in Sam, ON, at CHOA, CHOA.org. And always happy to answer any questions.
And with that, I will end with 3 things. Social distance, wear a mask, okay, and 6 feet apart. Thank you, everyone. This is our first session of Defeating Disparities. I hope you enjoyed it and have a blessed evening. Bye-bye.